Hi everyone, I'm Dr. Julie here, and June is Men's Health Awareness Month, and there's definitely a lot of men in my life that I care about, like my dad, but my brother also, I better give a shout out to him as well. But if you have a men in your life that you really care about, or even if you don't and you want to learn more about it in case you're gonna have kids, etc. What's interesting is that men are at higher risk for cardiovascular disease. And I care about your heart health. I'm giving you all the fingers into the heart because I really do care. So what we're really looking at is that what are the factors that can make your heart healthier? One of the biggest things, obviously, is to make sure that you're in a healthy weight range. So, and if you're going to try to lose weight or gain weight, try to do it in a healthy way. And so sometimes genetically, we have a propensity towards being able to process certain foods better than others. So if we know that genetically we process certain foods better, we should eat the food groups that works more in our favor and works with our body instead of against it. And then what's also interesting is that obviously as you get older, your cardiovascular risks are higher, and there's nothing I could do about that with the aging part. I wish I did. But there's also other factors like making sure that your blood pressure is looking good, that your diet is not going to worsen any genetic predisposition for hypertension. Your activity level is very important. Your stress level is very important. So learning to manage your stress, and if you have the genetic propensity for like anxiety or insomnia, to make sure that you address those things, like making sure your sleep cycle is regular or having good sleep hygiene, making sure that you're taking supplements like magnesium if you're low for things like blood pressure and heart health, and also for anxiety and for insomnia. It's a good all-rounder for helping a lot of things. But then also for things like for your exercise. So what kind of exercises should you be doing? What's interesting is genetically, some of us are better at obtaining benefits from doing endurance training, and some people are genetically better at getting benefits from doing interval training. So knowing what's actually ideal for you is very important so that you can optimize the time that you do have, because if you're busy and stressed, that can contribute to a heart disease. And doing a really long workout when you don't have that time, we don't want that because that adds more to your stress. So you want to optimize the time that you are working out. What's interesting though is that if you already have cardiovascular disease, couple safety points, you got to make sure that your doctor's okay with you exercising before you start. And then the other factor is that if you're already on medications like statins or Lipitor, they actually can deplete your body of something called CoQ10. And so things like CoQ10, ubiquinol are important for repletion. So that's important to kind of keep in mind. But understanding what your genetics are as far as diet, exercise, what propensities can exacerbate heart disease, like insomnia, anxiety, depression, because there are studies about how depression can worsen the outcomes of heart disease issues. So all of those factors are important because knowledge is what gives you the tools to be healthier for that, so that you can be proactive. So if you have any more questions, feel free to comment below.